Quetiapine is an atypical antipsychotic medication primarily used to treat mental health conditions like schizophrenia and bipolar disorder. It's also prescribed as an adjunct treatment for major depressive disorder. Quetiapine belongs to the second-generation antipsychotics, also known as atypical antipsychotics. These medications are designed to target both dopamine and serotonin receptors, aiming to reduce symptoms of psychosis with fewer side effects compared to first-generation antipsychotics. Mechanism of action means. How does quetiapine work? Quetiapine functions by antagonizing multiple neurotransmitter receptors in the brain. Dopamine D1 and D2 receptors helps in reducing psychotic symptoms. Serotonin 5-HT2 receptors contributes to mood stabilization. Adrenergic receptors alpha-1 and alpha-2 influences blood pressure regulation. Histamine H1 receptors accounts for its sedative properties. Its major active metabolite, norquetiapine, also plays a role by inhibiting norepinephrine reuptake and acting as a partial agonist at 5-HT1A receptors, further contributing to its antidepressant effects. Indications and their explanation. Schizophrenia manages symptoms like hallucinations, delusions, and disorganized thinking. Bipolar disorder, manic episodes, controls elevated mood, overactivity, and impulsiveness. Depressive episodes, alleviates feelings of sadness, hopelessness, and lack of energy. Major depressive disorder, adjunct therapy, enhances the effectiveness of primary antidepressant treatments in individuals who have not responded adequately to them. Dose and administration. Schizophrenia adults. Day 1, 25 mg twice daily. Day 2, 50 mg twice daily. Day 3, 100 mg twice daily. Day 4, 150 mg twice daily. Target dose typically ranges from 300 to 400 mg daily, divided into 2 or 3 doses. Dosage adjustments should be made based on individual patient response and tolerability. Recommended dose. The dose may be adjusted between the range of 150 to 750 mg per day, and the maximum dose is 750 mg per day. Manic episodes, adults. For the treatment of moderate to severe manic episodes in bipolar disorder, Seroquel or cut-in should be administered twice a day. Day 1, 50 mg twice daily. Day 2, 100 mg twice daily. Day 3, 150 mg twice daily. Day 4, 200 mg twice daily. Target dose, 400 to 800 mg daily, divided into 2 doses. The usual effective dose is in the range of 400 to 800 mg per day. The maximum dose is 800 mg per day. Depressive episodes, adults. For the treatment of major depressive episodes in bipolar disorder, Seroquel or cut-in should be administered once daily at bedtime. Day 1, 50 mg, once daily at bedtime. Day 2, 100 mg once daily at bedtime. Day 3, 200 mg once daily at bedtime. Day 4, 300 mg once daily at bedtime. Target dose, 300 mg once daily. Some patients may benefit from 600 mg daily. However, the potential for increased side effects should be considered. Normally, the maximum dose is 300 mg per day. For preventing recurrence in bipolar disorder. For preventing recurrence of manic, mixed, or depressive episodes in bipolar disorder, patients who have responded to quetiapine for acute treatment of bipolar disorder should continue therapy at the same dose. The dose may be adjusted depending on clinical response and tolerability of the individual patient, within the range of 300 to 800 mg per day administered twice daily. It is important that the lowest effective dose is used for maintenance therapy. As with other antipsychotics, Seroquel should be used with caution in the elderly, especially during the initial dosing period. Major depressive disorder, adjunct therapy. Day 1, 50 mg, once daily at bedtime. Day 2, 50 mg, once daily at bedtime. Day 3, 150 mg once daily at bedtime. Target dose, 150 to 300 mg once daily at bedtime. The Quetiapine XR dose in schizophrenia, bipolar 1 disorder, manic or mixed. Initial dose is 300 milligrams daily. Recommended dose is 400 to 800 milligrams per day, and the maximum dose is 800 milligrams per day. In bipolar disorder, depressive episodes 50 milligrams per day, the recommended dose is 300 milligrams per day. Administration tips. Quetiapine can be taken with or without food. Extended-release tablets should be swallowed whole, not split, chewed, or crushed. Now, let's talk about common side effects, which include sedation and drowsiness, dizziness and orthostatic hypotension, dry mouth, weight gain, increased appetite, rare but serious side effects, tardive dyskinesia, involuntary, repetitive body movements, neuroleptic malignant syndrome, NMS, a life-threatening neurological disorder, QT prolongation, changes in heart rhythm, which can be serious, contraindications and precautions. Who should not take quetiapine? Individuals with a known hypersensitivity to quetiapine or any of its components. Patients concurrently using strong CYP3A4 inhibitors, for example ketoconazole, ritonavir, or inducers, for example phenytoin, carbamazepine, as they can significantly affect quetiapine levels. Elderly patients with dementia-related psychosis due to an increased risk of death. Pharmacokinetics. Absorption. Quetiapine is well absorbed orally, with peak plasma concentrations occurring approximately 1.5 hours after ingestion for immediate release formulations. Distribution. Approximately 83% of quetiapine is bound to plasma proteins. Metabolism. It is extensively metabolized in the liver, primarily via the cytochrome P453A4, CYP3A4, enzyme, into its active metabolite norquetiapine. 73% elimination occur through urinary and 20% through feces. Half-life. 7 hours parent compound. 9 to 12 hours active metabolite norquetiapine. In last, quetiapine worsens intellectual functioning in the elderly with dementia and, therefore, is not recommended. It is sometimes used off-label, often as an augmentation agent, to treat conditions such as Tourette syndrome, musical hallucinations, and anxiety disorders.